Hi, everybody. I'm Dr. Ardis. This is the Dr. Ardis Show, and I'm so excited to be here. I don't know if you noticed, but our pre-sales have launched for the new book of mine titled Moving Beyond the COVID-19 Lies, Restoring Health and Hope for Humanity. Get your copies now. If you didn't see the video yet or the email that came out, I actually asked everybody, when you go to buy a copy, make sure you get a second one that you can give to any healthcare provider you admire, you love or revere, or you continuously see on a regular basis. I need medical doctors, chiropractors, acupuncturists, naturopaths, homeopaths to all have copies of this book so they know how best to help you in the future dealing with anything they call long COVID, vaccine injuries. Chapters 14 and 15 of this book have never been presented before. It's been a monumental task to get this ready, but it is now ready. Go get your pre-sale orders. They won't ship until the middle of September. At the latest ever would be the last week of September that you would receive it if you order it now. The goal is to have these in print ready to go, and I'm hoping to have some there at the Healing for the Ages conference in September. But just in case, make sure you get your orders in so you can get those there. I'm very, very excited, and thank you to the team of publishers, editors that have helped me so much, and the book strategist, my family who've all designated time away from them to make sure this book was done and complete. This is a complete summary of what I've learned over the last 4.5 years since COVID started, numbers of those lies that have been promoted, and then how to make sense of your symptoms that anybody's dealing with. It is an incredible accomplishment to be finished with it nonetheless. Whether or not people see it that way when it comes out, I'm hoping it blesses the lives of millions around the world personally, because COVID affected billions around the world. Let's hope we can help millions. That would be amazing. All right, so get your copies there at thedrardisshow.com. Okay, what we're going to do now is I'm going to do an entire presentation on how to beat arthritis. I'd like to give some credit to my team. I'd like to give credit to my son, Braden, who's in college now and has helped me put together a lot of the slides, actually all the slides for this presentation, and helping to compile the research to lay this out in a narrative that helps me while working on this book have the time to be able to do my weekly podcast as I have committed to the audiences for the last several years. All right, so I'm going to share my screen as normal. If you know anybody, just so y'all know, in America alone, 55 million people have arthritis. If you have arthritis or someone you know has some form of arthritis, there's multiple forms. This show is for you. It is for them. So please share it with them. The very first thing we're going to do is actually set the stage for how many people are affected worldwide and in America of arthritis of any kind. What's the definition of arthritis? What different forms are defined as medical diagnoses? What are the drugs most commonly prescribed for these conditions, and what are their most horrific, terrible side effects that are the most common that all of you need to know about? I'm telling you, this presentation, all of you who have elderly parents or grandparents who have been diagnosed with an arthritis of some sort, rheumatoid arthritis, osteoarthritis, it doesn't matter. Whatever they've been given a diagnosis of, they're on these drugs I'm about to go through. Every single one of those drugs have horrific side effects that would look like symptoms or signs of aging, but they're not. They're actually published side effects of these drugs, supposedly to mitigate your loved one's suffering. Most of the aging processes your loved ones are going through, the dementia, the gait issues, the bleeding, the bruising, all of these are actually attributed directly to the drugs they're on for arthritis. Do you know which ones those are? Because if you are concerned about your loved one's memory, their ability to speak, their gait, their appetite, their bruising, their skin, you name it, you got to look at these drugs. You have to know what they do so you can ask your doctor to get you off of those and help your loved one get off of them also. The less amount of drugs, the less sick you're going to be, the less symptoms you're going to have. All right, so we're going to dive into this. We hope you enjoy the show, but here we go. Let's bring up the screen sharing. Oh, and just so you know, I'm going to go ahead and say it. The sponsors for this show are these individual supplements: N-acetylcysteine, vitamin D3, selenium, and taurine. You're going to learn why here. I'm going to show you some research studies at the end of this presentation, which prove that these 4 nutrients are actually anti-arthritic, and why it is you should supplement it or get it to the loved ones who are struggling or suffering. All right, you should be able to see the screen now. You should be able to see the title, How to Beat Arthritis. I'm going to dive right in. Here we go. You can scan here this QR code. It will allow you to put in your email address. It will then, you will be put into a bank of data where we can email you each week our updated presentations, our book information, where I'm going to be speaking, anything related to what I'm doing. If you want that information or want this PowerPoint presentation, you can get it underneath patient resources at the drardisshow.com. You can also get there by quickly QR scanning that code. All right, so let's first define from the NIH what it means to have arthritis. So arthritis has a very specific definition. It's on the screen as I go one slide after the other to build this narrative for you, to help you understand what arthritis is, what the various types are, and the severity of problems their drugs they prescribe create for you and your loved ones. Every time I put up a slide, pay attention to the red underlined statements as usual. For those who are normal audience members, for newbies, I highlight everything I want you to look at. So you're going to follow along with the red highlighted sentences. Arthritis literally means joint inflammation. Joints are places where two bones meet, such as your elbow or your knee. There are many different types of arthritis with different causes and treatments. And some types, other organs, such as your eyes, heart, or skin, can also be affected. Here are various types of arthritis from the NIH website and from the same paper I was just showing at the beginning. On the previous slide, here are the various forms of arthritis that either you or your loved one are struggling with. Ankylosing spondylitis is a type of arthritis that causes inflammation in the joints and ligaments of the spine. Gout is a type of arthritis that occurs as flares, typically in your big toe or lower limb. My audience members will know I used to have gout. I had it for 10 years, and I figured out how to reverse it, took no drugs. It wasn't really a disease as much as it was something I was eating too much of. Once I took that out of my diet, it went away within the same week. It's never returned 20-something years ago. All right, juvenile idiopathic arthritis. Juvenile means in children. Idiopathic is a medical term that they like to use a lot. Idiopathic means we don't know what causes it. So they call it juvenile, children. We don't know what causes it, arthritis. That is exactly what that title means. It says here, it is the most common type of chronic arthritis that affects children. So maybe you have a nephew or niece, child, grandchild that deals with this. You got to get them this presentation. Osteoarthritis is the most common type of arthritis and is more common in older people. Osteoarthritis is different than rheumatoid arthritis. You'll see at the bottom of the screen. Osteoarthritis, it gets better as you use your joints throughout the day. You wake up and your pain's the worst as you're moving. They get better. That's osteoarthritis. The opposite is if you wake up with slight amounts of pain, but it gets worse as you use your hands or your other joints. That is typically rheumatoid arthritis. It's really the only difference. Psoriatic arthritis is the next on the list. This is psoriatic plaque, psoriasis. The plaquing on your skin leads to arthritis. Can occur in people who have psoriasis, scaly red and white skin patches. It affects the skin, joints, and areas where tissues attach to the bone. Reactive arthritis. This is a type of arthritis that comes and goes. It's caused by an infection in your body. When you've ever had the flu, all your joints will hurt for a few days. This is an example of reactive arthritis. Symptoms often clear up on their own within a few weeks or months after the infection's gone. Rheumatoid arthritis, they mention here, is an autoimmune form of arthritis where the immune system attacks the healthy joint tissues. Here are some crazy statistics on arthritis. So if you don't think you know somebody with arthritis, you do. You just haven't talked to them or gotten to know them. Emerging issues in arthritis. This is from health.gov. Arthritis is currently reported by 54.4 million United States adults. That's a lot, seeing how there's only like 200 million adults. That means a quarter of them, 1 out of every 4, has arthritis of some sort. Now let's read even further. The prevalence of arthritis is projected to increase to 78.4 million adults in 2040. Yes, in the United States. Now they're creeping up on 50% of all arthritis patients, or all U.S. adults, will be arthritic by 2040. How common is arthritis? Here on singlecare.com's website, they post more than 350 million people have arthritis globally. In the United States, 1 in 4 adults has arthritis, per the CDC. It's estimated that by 2040, 78 million, they mentioned again, U.S. adults will have arthritis, per this article, 2016, from a journal called Arthritis in Rheumatology. They continue in this article, I highlight in red, osteoarthritis is the most common joint disorder in the United States. Rheumatoid arthritis, when you go to the bottom, affects more than 1.96 million adults in the United States. If you look above, I didn't highlight this yet, but read this. Gout, the second bullet point. Nearly 9 million Americans have gout. Juvenile arthritis. About 1 child in every 1,000 develops some type of chronic arthritis. Arthritic statistics by age. 60% of people who have arthritis are between the ages of 18 and 64. Does that shock any of you? It should. It shocked me when I read it. 60% of people who have arthritis are between the ages of 18 and 64. That's the working age group of Americans. I would have always thought, and I bet you did too, people who are retired in their 70s and 80s have the highest amount of arthritis. Nope, it's most often diagnosed in the young and middle-aged. Arthritic statistics by race and ethnicity. 41.3 million white people have been diagnosed with arthritis. 6.1 million black people have been diagnosed with arthritis. That's a lot. That's 47 million of them are white and black. Arthritis and overall health. As many as 88% of people say arthritis affects their quality of life. 24 million US adults are limited physically by their arthritis. Arthritis is the leading cause of disability in the United States of America. More than 560,000 hospitalizations in the United States involve rheumatoid arthritis annually. People with osteoarthritis, the type of arthritis that gets better as you use your joints during the day, have a 24% higher risk of getting heart disease than those without it. Well, we can explain that one. The same thing that causes arthritis causes heart disease, excess calcium. So stop supplementing calcium if you have arthritis or are worried about heart disease. Unless you want heart disease and arthritis, keep supplementing calcium. The cost of arthritis. Listen to these costs of how many Americans have arthritis. Work, disability, medical care, and lost earnings related to arthritis alone cost the United States public health system more than $303 billion every year. Osteoarthritis accounts for more than $16 billion. Now we're going to get into the drugs that they commonly prescribe for you or your loved one if you have arthritis. These are called DMARDs for short, DMARDs. And that's abbreviated, as you can see on the screen, as disease-modifying anti-rheumatic drugs are used to decrease inflammation, shortly abbreviated into an acronym called DMARDs. And they write that the most common DMARD drugs used to treat arthritis, including rheumatoid arthritis, include this. Plaquenil is the first one. Plaquenil has another name. The generic name is hydroxychloroquine. Yes, the same drug you heard about during COVID, hydroxychloroquine, an anti-parasite drug, one that also worked for COVID, is also known as Plaquenil for rheumatoid arthritis patients. The next three on the screen are Arava, leflunomide is its generic name. The next most common one most people in America know is called methotrexate. Its brand name is Trexall, and then a brand name of drug called sulfasalazine, otherwise known as brand name-wise azulfidine. We're going to keep going. We're going to dive first into Plaquenil, which is hydroxychloroquine. This is from written by someone named Alex, March 2024, for Medical News Today. She writes, Plaquenil side effects, what you should know. Well, here you go. Anybody that you know that's on Plaquenil right now, which is one of the drugs my 11-year-old sister was put on when she was 11 for lupus. Plaquenil, this is actually published side effects on Medical News Today. Serious side effects that have been reported and their symptoms include ear or hearing problems for anybody on Plaquenil or hydroxychloroquine. Please, for the love of God, anybody who's still worried about COVID-19 and might be on hydroxychloroquine, you have to know these are their published side effects. Stop taking it. You can have ear or hearing problems, which include deafness, tinnitus, ringing in your ears, balance problems, dizziness, trouble hearing, or loss of your hearing. Are you more worried about going deaf or getting a cough they call COVID? Another side effect of Plaquenil, known as hydroxychloroquine, is blood disorders, including low levels of white blood cells, low levels of red blood cells, or low levels of platelets. So everyone was told these were side effects of COVID. Did you know that Plaquenil and hydroxychloroquine causes this exact symptom, these blood disorders? And just so you know, read the small bullet points underneath the highlighted statement. The blood disorders include these symptoms: bleeding from your gums or nose, feeling tired, headaches, and infections. They also include serious side effects of hydroxychloroquine or Plaquenil, the brand name, liver problems, including liver failure. I don't know. Did you know you were signing up for a liver transplant one day if you started on Plaquenil and hydroxychloroquine? How would you know you were having liver failure while on this drug? Your skin will turn yellow. You'll be diagnosed with jaundice. You might become nauseous and have abdominal pain. Another side effect of hydroxychloroquine or Plaquenil is hypoglycemia, low blood sugar, causing confusion, dizziness, and sweating. Hydroxychloroquine or Plaquenil is also published to have this serious side effect: muscle or nerve problems. Symptoms can include muscle cramps, muscle spasms, muscle weakness, stiff muscles, weakened reflexes, sleep problems, including nightmares. Suicidal thoughts or behaviors is another serious side effect of hydroxychloroquine. Did you know that? Uncontrollable eye problems, like you can't control your eyes, ocular eye problems, retinal detachment, cataracts, glaucoma, skin reactions like psoriasis, cardiac heart problems, and allergic reactions. Some people have a serious side effect after hydroxychloroquine, which include these. I mean, look at the list. Bruising that happens more easily than usual. Not just Coumadin does that. Hydroxychloroquine does it. Frequent infections with a high temperature, sore throat, or mouth ulcer. Did you know that? Did you know once you start hydroxychloroquine, you'll get sick more often? Signs of low blood sugar, skin reactions, such as a large area of scaly skin. Do you know what that is? Eczema and psoriasis are a published side effect of hydroxychloroquine or Plaquenil. Look at the last serious side effect of hydroxychloroquine. Irrational thoughts, feeling anxious, seeing things that are not real or hallucinations, feeling confused or feeling depressed, including thoughts of self-harm, even if you have never had similar problems before. Forbes magazine published in 2020, hydroxychloroquine, a drug that Donald Trump promoted to treat COVID-19, is linked to 17,000 deaths, estimates show. Well, just so you know, hydroxychloroquine and all drugs are toxic and deadly. You should try to avoid them at all costs. Emergencies are fine. Once the emergency is over, let it go. There is no emergency of COVID right now. You can let that crap go. All right, the next DMARD drug we're going to highlight is methotrexate, otherwise known as Trexall. This is another drug that was given to my sister, for example, when she turned 11 for lupus. Trexall, you can see it at the top, also known as methotrexate. You also see that right below it. This is off of WebMD. You can see at the bottom of the screen where I'm getting this information. Trexall, or methotrexate, has these listed side effects, and we're going to dive into them. In the same article, you read, serious side effects of methotrexate include mouth sores, diarrhea, signs of anemia, signs of liver problems, easy bruising, bleeding, black stools, enlarged glands and lymph nodes, yellowing of the eyes and skin, bone pain, unusual pain and discoloration of the skin, signs of kidney problems such as change in the amount of urine, dry cough, muscle weakness. Then it reads this: get medical help right away for anybody on methotrexate, called Trexall, who has any of these serious, very serious side effects, they say, that include weakness on one side of the body. That would be like a stroke, or like Guillain-Barré syndrome or polio. If you have symptoms of a stroke or being paralyzed on one half of your body, it could be methotrexate. Neck stiffness, severe headaches, vision changes like double vision, glaucoma, increase in eye pressure, retinal detachment, and blindness. Yes, these are all vision changes. Irregular heartbeat is a published side effect of methotrexate. Mental mood changes and seizures. Also, they write, this medication may lower your ability to fight infections. I hope you and your elderly loved ones know it. If you're really worried about flu season and you believe, as your elderly loved ones tell you, that they believe they need a flu shot, remind them they're on drugs like methotrexate, like Plaquenil and hydroxychloroquine, which lower your ability to fight infections. Now, serious side effects of methotrexate include, and this is off of Medical News Today, lung problems, such as stiffening or inflammation or swelling in the lungs. Kidney problems, such as kidneys not working well or kidney failure. Ulcers, sores, or bleeding in your digestive system that would appear as tarry or black stools or blood in your stools, or vomiting blood. Did you know that methotrexate, look at the second bullet point on the right, highlighted. Did you know that methotrexate, known as Trexall, causes lymphoma cancers? We'll read the bullet point. Lymphoma, cancer in the lymph nodes, You would know the signs and symptoms because these are your symptoms: itching, swollen lymph nodes, loss of appetite, weight loss, fever, and tiredness. Did you know that methotrexate also causes severe skin reactions such as Stevens-Johnson syndrome? Those of you who have it, you know exactly what that is. You could have rashes from methotrexate, redness, swelling, blisters, peeling, itching of your skin, sloughing of even the skin on your penis. That has been a reported side effect of methotrexate. Did you know that methotrexate shuts off cells in your body from killing cancer cells? Look at the last bullet point. There are cells in your body called tumor lysis cells. They kill cancer cells. Those cells that protect you from developing worsening cancers, methotrexate kills those cells, making your problem worse. Here's a published paper from 2018 about methotrexate. Let's read the title together. Severe harm and death associated with errors and drug interactions involving low-dose methotrexate. A couple points here. This title of the paper does not read severe harm and death associated with high-dose methotrexate. This is severe harm and death associated with low-dose methotrexate. What's a low dose of methotrexate? You're about to learn. It's 20 milligrams once a week is associated with these death outcomes. So let's just read a little bit out of this study. Most errors, people dying while on methotrexate, involved accidental daily dosing of oral methotrexate that was intended for weekly administration instead. So the patient would get home, read that it said 20 milligrams of methotrexate in a week, but didn't read that was per week. They thought it was per day, so they took a pill every day. Let's read the next highlighted sentence. 2 of the 3 incidents they're going to highlight in this paper in September 30th, 2015 involved patients who were taking no more than 20 milligrams of methotrexate in a week. Yet they died of severe methotrexate toxic effects. And they actually took it right. They took it 1 pill once a week, 20 milligrams. And they died due to other risk factors, including drug interactions of other drugs the patients were on also that increased the blood concentration of methotrexate. Do you think your medical doctor knows all the drugs that methotrexate increases the toxicity of, or which drugs increase the toxic effects of methotrexate that could lead to your loved one's death early? Well, it's being reported in research studies. Here's an example of one of the 3 cases in this paper. They state that an elderly patient with rheumatoid arthritis was admitted to the hospital for treatment of a fracture caused by a fall. How many of you can relate or have loved ones that can relate? Read the next red highlighted sentence. The patient developed renal failure and subsequently died in the hospital. And then it says the last statement is the patient died as a result of methotrexate toxicity. Now, in this scenario, they used methotrexate to try to turn off pain. It's used in arthritis for pain. So they used this drug, methotrexate, to try to stop the pain in this elderly patient who fell and broke some bones in their body. Only the patient died from methotrexate poisoning. This article, they state, highlights the importance of initial screening for risk factors and ongoing monitoring for methotrexate toxicity, even when this drug is prescribed at low doses. These scientists are warning medical professionals, and I'm warning you lay people. If your loved one or yourself is told to take methotrexate, they know, read the next sentence, that methotrexate is a high alert drug and extra safeguards are needed whenever it is prescribed, when it's dispensed by a pharmacist, and when a patient swallows it, regardless of the setting, regardless of the dose, regardless of the indication for use, why it is the doctors are giving it to you. While severe harm and fatalities have occurred during hospitalization, many of the adverse outcomes have occurred after the patients were released from the hospital. That means they were put on that drug in the hospital, sent home with that drug, they kept taking the drug, and they died as a result of being overdosed on that drug. It is important for hospitals not only to ensure that the proper dosage regimen is administered during the hospitalization stay, but also to implement effective proactive strategies so that the proper dosage regimen is maintained after discharge from the hospital. This drug, methotrexate, is super toxic, and they're telling you gotta pay attention when you're prescribing it, giving it to people. It can have a lot of drug interactions and horrible outcomes even after they're released from a hospital. If it's that dangerous, how many of you think you know how to use it appropriately? All right, let's continue here. We're going to go to Healthline magazine. There are also injectable drugs for arthritis. One of the most common is called a biologic. It's called Humira. Humira, you've heard and seen commercials and radio announcements for. It's very, very popular. Humira is a monoclonal antibody, and you can tell that by its generic name on the screen, adalimumab. MAB on the end of that name stands for monoclonal antibody. All right, so what does Humira do? Well, the first thing I'm going to do is I'm going to play a commercial on Humira. Please listen at home. I want you to listen. If you're watching, watch it. I want you to pay attention, though, to the listed named side effects in the commercial of Humira. Because if you're on Humira, if you have a loved one on Humira, you've got to make sure you can focus on the commercial and listen to the side effects they mention. Because if you are going to start Humira, if your loved one is being prescribed Humira and they start taking it, you have to know all these problems are going to happen. All right, so let's get into it. Here we go.
Many people with moderate to severe ulcerative colitis or Crohn's disease, I was there. Be right back. My symptoms were keeping me from where I needed to be. So I talked to my doctor.
Pay attention.
It's for people who have UC or Crohn's disease. And Humira helps people achieve remission that can last. So you can experience few or no symptoms.
Listen.
Humira can lower your ability to fight infections. Serious and sometimes fatal infections, including tuberculosis and cancers, including lymphoma, have happened.
Fatal cancers and infections.
Serious allergic reactions and worsening heart failure.
New heart failure or worsening heart failure.
Or flu-like symptoms or sores. Don't start Humira if you have an infection.
Be there for you and them. Ask your gastroenterologist about Humira. With Humira, remission is possible.
Did you listen to the actual side effects that they just described? I hope you did. New or worsening heart failure. Heart failure by nature means your heart stops and you die of a heart attack. They're telling you Humira causes heart attacks that end your life. Heart failure is when the heart stops. Humira can make your heart failure worse, or it can cause your heart to fail, even if you've never had heart failure. Also, they said it can cause cancers like lymphomas. They also said it can cause deadly fatal infections. These are the known side effects of Humira. If a loved one of yours is diagnosed with arthritis, then put on Humira, and then they soon develop some infection that they call pneumonia or insane pneumonia or sepsis. How do you know it's not a side effect of the drug? What if they are then, after being put on Humira, 6 months, a year later, now are diagnosed with lymphoma cancer, Hodgkin's lymphoma, non-Hodgkin's lymphoma, for example? What if it's after they started Humira? Well, that drug causes cancer and it causes deadly infections and it can stop your heart. What if your loved one takes Humira, a month later they die of a heart attack while mowing the yard? Are they going to blame it on heat exhaustion and global warming? Or are you going to literally make them do an autopsy and see if he's been poisoned to death with Humira? I find that really disgusting. All right, we're going to continue here. This is on Humira's website underneath important safety information. They quote, and I quote, serious infections have happened in people taking Humira. These serious infections include TB and infections caused by tuberculosis and caused by fungi, bacteria that have spread throughout the body. And some people have died from these infections. How many infections do elderly people battle? How many of them are dealing with urinary tract infections every week because of their drugs, like Humira? Cancer, they tell you here, cancer is a side effect of Humira. What should I watch for after I start Humira? This is on the same website for Humira. Humira can cause serious side effects, including TB infections caused by viruses, fungi, or bacteria. Hepatitis B infection can come from people who have the virus, and now you will become positive for the virus because it suppresses your immune system. You can have allergic reactions, which include hives, trouble breathing, swelling of your face, nervous system problems that include numbness or tingling. How many elderly people already deal with that? Weakness, vision issues, weakness in your arms, legs, and feet. Blood problems, for example, decreased blood cells. Well, if you have lowered white blood cells, they call that leukemia. What if you're on Humira then diagnosed with leukemia? That's another form of cancer. How do you know that's not being caused by Humira? Humira causes blood problems. You're looking at the screen. It can lower blood cells that help fight infections or stop bleeding. This can be known or seen by bruising and becoming very pale. Heart failure, either new heart failure or worsening heart failure. Symptoms include shortness of breath, swelling of your ankles, feet, and sudden weight gain. Well, I don't know about you, but when someone's joints hurt, do you think that creating a new heart disease or heart failure scenario is better than having a finger that hurts when you move? Ask your doctor if heart failure is right for you when they prescribe Humira. What about immune reactions, including a lupus-like syndrome, like butterfly rash on the skin of the face, rashes, joint pain, can be an absolute side effect of Humira, causing lupus. Liver problems, psoriasis. Imagine never having psoriasis on the outside of your body, only having pain inside your joints that people can't see. Then you start taking Humira, they publish you can have new psoriasis come as a side effect of Humira. Well, now would you like to have pain inside your body and be embarrassed by the skin on the outside of your body? Get off Humira. It's ridiculous. You don't need psoriasis also. Here's a summary on webmd.com. Humira pen injection kit. Let's read their side effects. Serious side effects of Humira include fast, irregular, pounding heartbeat. Well, how many of you or elderly loved ones are struggling with heart disease and already have these problems? Do you think Humira is still right for them? It has this serious side effect. What about worsening symptoms of heart failure? Yeah, that sounds better. What about blood in the stools, severe headache, easy bruising and bleeding, mental and mood changes? Yeah, because we don't like people the way they are. Let's change their moods. Let's make them agitated, schizophrenic, paranoid, numbness or tingling of the arms, hands, legs, or feet, unsteadiness, unexplained muscle weakness, difficulty with speaking, chewing, swallowing, facial movements, vision changes, joint pain, butterfly-shaped rash on the nose and on the cheeks. That is the lupus rash. And then you'll see at the bottom, it can also cause fatal liver disease in people exposed to hepatitis B. So if you're not on Humira and you get hepatitis B, it's actually more dangerous to have hepatitis B than get on Humira. That's what they're telling you. Now, this is an article from a company called fiercepharma.com. This is dated June 2018, and it reads, title, AbbVie, AbbVie, which is the company that makes Humira, is slammed by the FDA for improper handling of Humira death complaints. Now, I'm not going to dive into that article, but if the FDA is on their butts for not disclosing or not responding to death reports appropriately, I think of all things, our government should make sure that we are not being sold or prescribed drugs that can kill us. And if they're finding out, and the companies that make the drugs are finding out it's killing people, I don't think the FDA should be playing around with them, and I don't know why it is they're still producing commercials. The next drug we'll talk about, which is a biologic, we talked about Humira already. The next one we're going to talk about is Enbrel, because a lot of people know what Enbrel is. You can see its brand generic name is etanercept, Enbrel. Enbrel has its own website. On its website, www.enbrel.co.nz, you can look up its side effects. Here's what are the most common side effects to Enbrel for you or a loved one who's on it. Common side effects include itching, soreness, redness, swelling, bleeding, or pain at the injection site. Infections, including colds and sinus infections, are very common from getting Enbrel. Less common side effects include headaches, runny nose, or rashes. Other side effects include reports of cancer developing in patients using Enbrel. Well, I don't know. Is having cancer better than just joint pain? Ask your doctor if cancer is right for you when they try to offer you Humira. These include skin cancers for Humira patients, cancers that affect the lymph system called lymphoma, and Kaposi sarcoma, which also affects the organs, skin, mouth, nose, or throat, or affect the blood system called leukemia. Humira, they're writing about it here. This is in STAT, S-T-A-T, 2017. Failure to warn is the title of this article. Hundreds died while taking an arthritis drug, but nobody alerted patients. Thank you, AbbVie. Thank you, Humira, for not warning other people being prescribed this drug and not letting medical doctors know people are dying from that drug. The next prescription drug we're going to talk about is Celebrex. Celebrex is a prescription, what's called NSAID. NSAID, most people know, stands for non-steroid anti-inflammatory drug. So Celebrex is a non-steroid anti-inflammatory drug. So Celebrex on the screen. We're going to dive into only two on this list, Celebrex and naproxen, because a lot of people know those two. Let's get into Celebrex side effects on drugs.com. If you or a loved one has someone on Celebrex, or you or a loved one are on Celebrex, you need to make sure they know these symptoms. Guarantee you many of them are taking this drug and have no idea what problems they're now complaining about with their MDs are actually published side effects of Celebrex. And the MDs don't know it. You don't know it, but you do after you watch this presentation. All right, so serious side effects of Celebrex. More common: cough, fever, skin rash, sneezing, sore throat, swelling of the face, fingers, feet, or lower legs. This is called angioedema. Less common And rare side effects of Celebrex, you might as well know. Abnormal growth in the breast. Did you know that if you get on Celebrex, it's known to cause breast tumors? Did you know that Celebrex can cause burning feeling in the chest or stomach, burning, tingling, numbness, or pain in the hands, arms, feet, or legs? That doesn't sound comfortable. Did you know Celebrex can cause chest pain, discomfort, tightness, or heaviness, and has been linked to heart attacks and strokes? Did you know Celebrex causes nerve pain? Did you know it can cause painful blisters on the trunk of the body, like bed sores or like shingles? Did you know that Celebrex causes stabbing pains in the body or stomach pains that are severe? Did you know that Celebrex causes heavy, non-menstrual vaginal bleeding? How many have been told that are on Humira that you might have endometriosis, when in fact you might just have Humira? Read the last one for me. Loss of consciousness is a published side effect of Humira. Okay, loss of consciousness is in a coma or dead. Trouble breathing. I don't know very many people who have arthritis who also want to have difficulty breathing, but ask your doctor if difficulty breathing is right for you, if they try to give you Celebrex. And then the last one listed there is vomiting of blood or material that looks like coffee grounds. Sounds disgusting. Vanderbilt wrote this article on Celebrex. They wrote, study links Celebrex to heart valve calcification after early research declared drug safe. So Celebrex is causing heart valves to be calcifying in humans, which is leading to pig valve transplants and human valve transplants. Okay. Did you know that Celebrex is causing it? Did you know Vanderbilt even reported on it? At Vanderbilt University, they have found a link specifically between Celebrex and heart valve calcification. Ask your rheumatologist when they recommend Humira or Celebrex particularly, ask them if heart valve calcification is right for you. W. David Merriman, professor of biomedical engineering and PhD. Student Megan Bowler started out by testing Celebrex on valve cells in an effort to see if it would double as an aortic stenosis therapy. They want to know if it would reverse the hardening of aortas. They write, as you can read on the screen, it made the problem worse. Patients who had taken Celebrex had a 35% increased prevalence of valve disease. So if you want 35 times more or 35% more chances of developing hardening valves that you need future surgery for, you should ask your doctor if Celebrex is right for you. The next one I'm going to talk about is naproxen, otherwise known as brand name naproxen. So naproxen, let's dive into this on drugs.com. Serious side effects of naproxen listed are the more common ones: chest tightness. So how many of your loved ones are feeling like they're having a heart attack when it's naproxen? Difficulty or labored breathing, pain in the chest below the breastbone. Sounds like a heart attack, but it's actually naproxen. Skin eruptions. These other are common but less common: blood or black tarry stools after starting naproxen, blurred or loss of vision, burning, upper stomach pain, loss of appetite, night blindness, double vision. I know my 92-year-old mother continues to be put in these glasses that can help you with double vision. Did you know it's a side effect of drugs? All right, the next one is, next list of side effects of naproxen are severe and confusing nausea or continuing nausea, severe stomach burning, cramping, or pain, trouble breathing, unusual tiredness or weakness, vomiting of material that looks like coffee grounds or beans. Let's go to NSAIDs. The side effect of NSAIDs, anything other than aspirin, they tell you, are ulcers, stomach irritation, erosion, or burning a hole through your stomach or intestines. That's what NSAIDs do: Tylenol, ibuprofen, you name it. Kidney damage and stomach bleeding. Let's stick with the third bullet point here. Did you know that Advil, Tylenol, these things can cause stomach burning or even a hole to develop in your stomach or your intestines? If it happens in your esophagus, they're going to call it Barrett's esophagus or esophageal cancer, when in fact it's naproxen, a drug you're swallowing. Kidney damage is another one. My son found this article and I had to share it with you. Harvard's med school, published this paper: common painkiller boosts risks of repeat heart attacks. Do you know which ones they're talking about? Common painkillers boost the risk for repeat heart attacks. Ask your doctor if repeat heart attacks are right for you when they tell you to just get an over-the-counter NSAID. After 1 year, Harvard said, those who used an NSAID were about 60% more likely to have died during each year of the study than those who didn't use an NSAID. Hold up, let's read that again. For each year of the study, there was an increase of 60% each year. More likely people were to die while on Advil, ibuprofen, than those who weren't on that every day. During the first year, there were 20 deaths per 100 people among the NSAID users, compared to 12 deaths per 100 people among the non-users. That's almost half of the amount in the first year. During year 5, check this out, it's even crazier. During year 5 of the study, there were 9.5 deaths per 100 NSAID users, and there was 6 deaths per 100 non-NSAID users. So it went from, during year 5, there were 9.5 deaths for every 6 deaths. Isn't that crazy? People who took any NSAID other than aspirin also had a higher risk of having a second heart attack. You know, they put you on aspirin to try to prevent heart attacks. Did you read that? People who took an NSAID other than aspirin also had a higher risk of having a second heart attack. There are opioids that are pain drugs also. We're going to flip through a few of these, like fentanyl, morphine, and another. Let's start with fentanyl. Fentanyl is being used all around the country for people, elderly particularly, who have like compression fractures in their spine. They'll put them on fentanyl. This is a very powerful, deadly, controlled substance. Serious side effects of fentanyl include on the screen: black tarry stools, difficult or labored breathing, painful or difficult urination, fainting, probably not a good idea while driving or walking with a walker, lightheadedness, tightness in the chest, and then ulcers, sores, or white spots in your mouth. Less common side effects of fentanyl, but still side effects: decreased awareness or responsiveness. That doesn't sound good. Muscle twitching or jerking. This is fentanyl, causes you to see, hear, or feel things that are not there. So it's making you live like a schizophrenic in your mind. Seizures and thinking abnormalities. You'll see shakiness in the legs, arms, hands, or feet. That can't help any elderly person. What about trembling or shaking of the hands or feet? Sounds like Parkinson's. Why would you want to put anybody with Parkinson's on this drug, fentanyl? We're going to continue with more opioid pain drugs. The next one is hydrocodone. Lots of people know about hydrocodone. We're just reviewing all arthritis drugs and why it is you need to be warned about what they do to you. So many millions of Americans and people worldwide are being diagnosed with arthritis, put on these drugs, and now have horrific living conditions and symptoms, and are being told it's just a process of aging. No, it's not. It's these drugs. You're being poisoned with chemicals that aren't natural. In fact, every single side effect or symptom listed of drugs, prescription drugs, are the exact same symptoms and side effects of ingesting poisons when you call poison control. So how come we look at drugs and go, you know what, it does the same thing all known poisons do, but we don't call drugs poisons? Why not? They do the exact same thing every other poison does on Earth. All right, I digress. Let's go into hydrocodone. Bloody or cloudy urine on hydrocodone, depression, difficult or labored breathing, fear or nervousness. I mean, seriously, look at depression and fear or nervousness. Would you like your loved one who's living in an assisted living home, nursing home, assisted living home, independent living home? Could you imagine them living now with more fear and anxiety and panic and depression? Rapid weight gain, tightness in their chest. Let's go to Demerol now. Demerol side effects on WebMD. Serious side effects of Demerol include interrupted breathing during sleep. It's called sleep apnea, people. That is not a CPAP deficiency. It is a Demerol toxicity. Mental mood changes such as agitation, confusion, and hallucinations occur with Demerol. Stomach, abdominal pain, difficulty urinating, slow, irregular, fast heartbeat, shaking, tremors. That's Parkinson's. Vision changes. Signs of your adrenal glands not working well, such as loss of appetite, unusual tiredness, and weight loss. Get medical help right away if you have any of these very serious side effects I'm quoting, including fainting, seizure, severe drowsiness, difficulty waking up. The last sentence highlighted reads, Demerol causes fast heartbeat, hallucinations, loss of coordination, severe dizziness. Think about all the elderly on wheelchairs and in using walkers. I'm not sure severe dizziness is going to be a good idea. Severe nausea and vomiting, diarrhea, twitching, muscles, unexplained fever, unusual agitation, and restlessness. Ask your doctor if any of these symptoms are right for you. Morphine is going to be the next opioid drug. This is very commonly used. It's the same one they used to kill my father-in-law. Called it palliative care in a hospital. Morphine kills you. Morphine is a deadly suppressant, just like fentanyl, just like Demerol. All right, serious side effects of morphine include burning, crawling, itching, numbness, prickling, pins and needles, or tingling feelings, dizziness, faintness, or lightheadedness when getting up suddenly from a lying or sitting position, hives, itching, or skin rash, severe constipation, severe vomiting, slow heartbeat. More common includes false or unusual sense of well-being. That's morphine. Like if they're doing really horrible, they actually don't feel it, so they'll tell you they're doing great. That's a false or unusual sense of well-being. Or they're actually really sick and telling you they feel well. Or they're feeling well, but they're telling you they feel sick, even though they're not. Bad or unusual or unpleasant taste in your mouth, like with COVID. Heartburn or indigestion is another morphine side effect. Problems with muscle control, uncontrolled eye movements, oxycodone. Let's dive into oxycodone. Difficulty or labored breathing, dizziness, faintness, or lightheadedness when getting up slowly from a lying or sitting position. How many of your elderly patients, or you, if you are elderly, actually sit up every morning in bed, get up from your recliner, and you're dizzy when you stand up? And how many of you are on one of these arthritis drugs like oxycodone, which causes this to happen? Twitching, difficulty having a bowel movement, lack or loss of strength, anxiety, burning feeling in the chest or stomach, false or unusual sense of well-being. This is oxycodone. I just want to show this fentanyl ABC News article from 2023. Fentanyl overdose deaths surged 279% since 2016, while heroin deaths fell. Fentanyl is a very, very toxic drug. All the opioid drugs are morphine, fentanyl, midazolam, Presidex, lorazepam, you name it. They're all super toxic, super deadly. That's just fentanyl. Now let's dive into cortisone, steroids for rheumatoid arthritis, including cortisone. Cortisone shots. Man, there's millions of these going out every single day. Holy cow. I bet you don't know any of the stuff I'm about to show you. Everyone thinks you just get this injection of this pleasant little hormone that blocks pain. Here's an overview from Mayo Clinic. Cortisone shots are injections that can help relieve pain, swelling, and irritation in a specific area of your body. They're most often injected into joints such as the ankle, elbow, hip, knee, shoulder, spine, or wrist. Even the small joints in the hands or feet might benefit from cortisone shots. Did you know that when they inject these inside of you, that Mayo Clinic has listed these serious side effects as side effects of cortisone shots? Number one, cartilage damage. How many of you have ever heard the term that you or a loved one has bone on bone? It could be your knees, your ankles, your hips, bone on bone. It could be your spine, bone on bone. Well, in between bones are supposed to be cartilage called discs. Synovial fluid also, cartilage. Well, it says here, cortisone injections cause cartilage damage to lead to bone on bone. So if you've gotten multiple cortisone injections and all of a sudden you have bone on bone and you're told you need a shoulder replacement, knee replacement, that's because you were taking cortisone shots that were killing cartilage. Did you know that cortisone, they state, the Mayo Clinic does, look at the second one, death of nearby bone. It doesn't say it's going to injure the bone or become toxic to the bone or fracture the bone. It causes the bone to die. Did you know that? Did you know that it causes joint infections? Cortisone does. What about a staph infection inside your joints? Think that's a good idea in your knees or in your ankles? No, they're deadly and cause strokes. You don't want that. Nerve damage can happen from cortisone shots. Short-term facial flushing. Short-term flare of pain, swelling, and irritation in the same joint. So those of you who got cortisones and it got worse, that's a normal side effect. Tendon weakening or rupturing, that would be cartilage damage. Thinning of nearby bone leading to osteoporosis. Did you know cortisone shots cause osteoporosis? Well, now you do. The University of Minnesota published this article from 2023, last year, titled Higher Dose Corticosteroids Tied to 60% More Deaths in COVID Patients with Low Oxygen. So there was a higher dose corticosteroid use was linked to a 60% increase in risk of death for COVID patients. Steroids used for rheumatoid arthritis include cortisone, dexamethasone, hydrocortisone, methylprednisolone, and then prednisone. I'm now going to focus on prednisone because it's probably the most prescribed steroid for all arthritises. You got to know this. This is really, really important. Every flu season, cold season, you're going to be told you need to get a flu shot to boost your immune system and protection against the flu. Did you know that prednisone, if you're on that, is an immune system suppressant and shuts off your immune system, and now you can't fight infections? You can't even benefit from the flu shot. You need your immune system to use the flu shot, supposedly. Well, if you're on prednisone, you don't have an immune system. It's been suppressed and turned off. Serious side effects of prednisone include aggression. Did you know that aggression, fighting, abuse, domestic violence, school shootings, did you know all these are known side effects of prednisone? Did you know that fast, slow pounding, or irregular heartbeats are a published side effect of prednisone? Well, how many of you are on prednisone and seeing a cardiologist for other issues with your heart, like arrhythmias, bradycardia, tachycardia? How many are being told you need new drugs for your heart or heart surgeries? What if the prednisone is doing it to your heart and you just got off of prednisone? Shortness of breath, trouble thinking, speaking, or walking. Do you have trouble speaking, thinking, or walking? Or does your loved one who's on prednisone have these issues that's worsening and you think it's aging and it is not? It is actually daily poisoning of prednisone. This is a published research article from 2016 titled Prednisone Use and Risk of Mortality in Patients with Rheumatoid Arthritis. So here's prednisone, its use, and the risk of death that comes to patients diagnosed with rheumatoid arthritis. Look at their conclusive statement. Anybody out there with rheumatoid arthritis right now, you're probably being given prednisone. You've never been told this. Prednisone use was associated with a significantly increased risk of death in patients with rheumatoid arthritis. The statistics are right above that in the paragraph above. Prednisone is associated with a significant increased risk of death in patients who have been diagnosed with rheumatoid arthritis. Now it's time to get into the solutions. We've only got about 10 minutes or less left in this podcast. All right, this is a published, I'm now going to get into 4 published nutrients that we know simply have benefits for arthritis, proven, and I'm going to show them here. This is the New Scientist online forum. It's an online website, www.newscientist.com. They state here on this article that the only existing treatments are painkillers and drugs for arthritis that reduce inflammation, but nothing halts or reverses the condition. The very next statement reads, when researchers added N-acetylcysteine, or NAC for short, NAC, to the drinking water that they gave to mice that had arthritis, it reduced the level of joint damage to that seen in the healthy control mice. So they had mice with arthritis, gave them NAC, and it reversed their joints to look like they were pre-arthritic mice. And I have to rehash here. Scientists publish over and over and over the reason why they study nutrients and drugs in mice is because mice have the same genes we do as humans. And they say over and over and over, if it happens in a mouse, it will happen to a human. If you have arthritis, you need to get on N-acetylcysteine. It is proven to reverse osteoarthritis, even in animal studies. Also in human studies. I'm just showing you this one. What was most impressive about this study I just showed you is when they gave N-acetylcysteine, the supplement, to the mice, it not only got rid of their arthritis, it reversed their joints to look like it did before they ever had arthritis. Everyone listening, you or your loved one are being told you cannot reverse arthritis. It's genetic. There's nothing you can do about it. Yes, you can. I just showed you. NAC can do it. Here's just one sample. I would recommend 1,000 milligrams of NAC. We have it at the Dr. Ardis Show. You can see it right there on the screen and learn more about it on our product pages. There are tons more research studies on the website under NAC. And NAC, I held up, is one of those products that is I'm using to promote this show. N-acetylcysteine. I'm holding it right here. All right, the next mineral I'm going to talk about is also found conveniently on the periodic table of elements. It's called selenium. And the article reads and is titled, The Effects of Selenium Supplements on the Disease Activity, Inflammation, and Stress in Patients with Rheumatoid Arthritis. What did they publish? That selenium helped to reverse arthritis and prevent arthritis in rheumatoid arthritis patients. That's why we have selenium at our website. The next supplement I have is a vitamin. It's called vitamin D3. We get it from the sun. You can get it from supplements. You can get it from my website. Get it somewhere. You need vitamin D every day. 20 to 30 minutes in the sun, morning and night, dusk or dawn, or try to supplement it. In this article on the website titled versusarthritis.org, it's titled, How Do We Get Vitamin D? A researcher at the beginning of this article writes this. Dr. Sarah Shanker, a dietitian and author of the British Diet Association's food fact sheet on arthritis, says vitamin D seems to have a role in reducing inflammation and keeping the immune system healthy, making it an important nutrient for different types of arthritises. Well, here's vitamin D. I recommend 5,000 to 10,000 international units every single day, and you should get it. The last one is actually one of my favorites to talk about because not too many people talk about this one, but this is called taurine. And taurine, I've educated audiences on. It's also one of those elements that's destroyed by glyphosate. Glyphosate's an insecticide herbicide that's in toxic levels in 90% of all farmlands, according to Dr. Stephanie Seneff of the MIT. If you want to learn more about glyphosate and its impact on taurine, get her book called Toxic Legacy. Stephanie Seneff, Seneff of MIT. I also did a podcast with her. You can go watch the entire podcast with me and Stephanie a couple of years ago. Taurine and inflammatory diseases. First statement, the fundamental role of taurine in the immune system is related to its antioxidant properties. Taurine protects tissues from oxidative stress associated with the disease processes of various inflammatory diseases. Taurine and taurine halamines are components of your innate immune system. I mean, what God built in you requires taurine. In conclusion, both in the lab and in the body studies, as well as clinical trials, give support to consider taurine and taurine derivatives as potential drugs in human medicine, including infectious diseases and inflammatory diseases, especially in the treatment of biofilm-associated infections. That's impressive. Taurine. Taurine, you can also get it at the drardisshow.com. And there it is on the screen. I also would like to make sure you're aware that our book now is ready for pre-sale orders. You can get your copy at thedrardisshow.com/book-launch, or just go to the Dr. Ardis Show or just scan the QR code there. I encourage everybody to buy 2 copies, at least minimum. You need to give one to your healthcare provider. Chapters 14 and 15 actually explain every single medical test and every cause of every single symptom related to COVID, long hauler COVID, long COVID, vaccine injury. It's all in there. What an incredibly difficult project that was to put together. Remember, you can scan this QR code to become a follower of our newsletter for the Dr. Ardis Show. You get once a week at least updates on what we're doing here at the Dr. Ardis Show, what we're researching. And then also you can get at Patient Resources tab this PowerPoint presentation on arthritis. Please go to healingfortheages.com and get ready for an incredible celebration of solutions. Cannot wait to show the world how the body heals and incredible nutrients found in nature that actually cure the body. I'm actually going to show you physical evidence of how the body heals itself. This has been How to Beat Arthritis. God bless you. Please share this with everybody, with anybody out there struggling with arthritis. The last thing I want to mention, if you haven't watched my presentation called The Other N-Word, it is very long. It's all about nicotine. I did not put it in this presentation, but inside the Other N-Word presentation, I introduced tons of diseases that are actually benefited by nicotine. Nicotine patches, nicotine pouches, even tobacco, even snuff of tobacco. I also list all the vegetables that nicotine is found in. Nicotine, in that presentation, I show several studies that nicotine is proven to have more anti-inflammatory benefits than pro-inflammatory benefits. Nicotine turns off pain more than it creates it. I have had people all over the country come up to me at different events and say, Dr. Ardis, after I watched your presentations on nicotine, I have struggled with arthritis in my shoulder, in my hip, in my knee. I just got the smallest nicotine patches I could find. I would put one on each shoulder, each knee or hip, whichever joint was bothering them the most. And within 3 days, they all reported that their pain disappeared. Then they would put new patches on other joints and they would see that pain disappear in a couple days. Do not be afraid of nicotine. If you want to know how to use nicotine, I am wearing a 3 milligram nicotine patch right now. I will for the rest of my life for all the reasons explained in the Other N-Word presentation at the Dr. Ardis Show. In Patient Resources is the PowerPoint presentation for this presentation on arthritis, for the Other N-Word PowerPoint, and also one called nicotine.pdf. And it's a very simple report that explains how to use nicotine for various types of nicotine agents and for different reasons you would use them, how to use them and when. All right, I'm Dr. Brian Ardis. The purpose of the Dr. Ardis Show is to create doubt in big pharma and restore your faith in nature. I hope this presentation has done some of that. I hope this provided some information and warning for you. that you can share with your loved ones who may be struggling with symptoms related to their treatments. There are other options for them. The last thing I would recommend and tell you, diet is huge. I have a loved one right now who lives in an assisted living home, and they're given dessert options every single meal. Sugar causes inflammation. There's a great book called The Deflame Diet book. It's $24.95. You can find it at deflame.com, deflame.com. I don't have anything to do with their website. I'm just telling you it's there. It's a great resource if you want to know how to change your diet, take these supplements, get off those drugs, talk to your MDs. They can help you get off of them slowly. Don't do it abruptly. If you need an advocate, go to graithcare.com. They can help you through the whole thing, even help you with your doctor appointments. I'm not joking. All right, I'm Dr. Brian Ardis. God bless you. Get your book at the Dr. Ardis Show. Get your PDFs and downloads at the Dr. Ardis Show. Share this far and wide with your loved ones. I love you. I'm grateful for you. We will see you next week.
Hi, I'm Dr. Brian Ardis, and I am so excited it is finally time to let you know that registration for the Healing for the Ages 2.0 dates September 12th, 13th, and 14th in Dallas, Texas are now available. I need to let you know though, there really truly is only 500 seats in person at this conference. So those are going to sell out fast. I would really love to see you there. So hurry up and get your tickets. I am so excited to have you there. Come join me, Dr. Ardis, Dr. Henry Ely, Dr. Ed Group, and Dr. Janice Schmidt for another thrilling Celebration of Solutions event, September 12th, 13th, and 14th in Dallas, Texas. We can't wait to see you there.